Welcome to Empowered. I'm Elizabeth Naumovski. Cardiovascular emergencies in women are today's topic. We're talking heart and brain because women's lives depend on it. And if you feel chest tightness or pressure, sudden shortness of breath, crushing fatigue, cold sweats, nausea, or pain in the jaw, back, or one arm, don't wait. Here's why speed matters. Minutes save muscle and brain. Early action means better treatment, fewer complications, and a stronger recovery. Prevention starts now. This is your heart. Let's protect it together. Today, I'm joined by Katina Giggey. She's CEO of LifeLime Teaching Limited. Kat, so wonderful to see you. I know you because I took CPR lessons from you. And the way that you taught and the way that you spoke with passion, I thought that this was a perfect topic today because so many women and men need to know what's happening to them or their partners. So let's begin.
Absolutely.
So signs of distress.
Yeah.
Women need to look out for whether it's a heart attack or a stroke. What do we need to know?
So stroke and heart attack are going to look very different in women and in men at times. Some of the symptoms do overlap. So for stroke, we're looking for fast. F is for face, A is for arms, S is for speech, T is for time. So face drooping, or we might see arms, hey, can you lift your arms for me? We're going to see one arm on that same side of the body that's drooping. We're going to see that it's not able to either put pressure or raise up. That's face, arms, speech. Now, slurred speech, confused speech is a big one. That's going to be across the board, men and women. Oftentimes, women, though, will experience migraines. This is more common in women than it is in men. Migraines with aura, which means you could see flashing lights, more confusion we might see, and fatigue in women. So that's a little bit different there. The T in fast is for time. So time is of the essence. They call it the golden rule for strokes. So if I can recognize that this is a stroke, right? Hey, can you raise your hands for me? I'm seeing, okay, maybe face is drooping or a severe migraine that's not going away in my wife, in my mother, myself. I'm going to 100% call 911 right away.
So let me ask you a quick question here,
Yeah.
because I suffer from migraines. Many women suffer from migraines.
Yeah.
Sometimes I see that aura around my eyes.
Yeah.
How do I know the difference?
It's a good question. The best way is, does it go away with time? With stroke, because it's going to be a blockage or a bleed in the brain, only surgery is going to be able to fully fix it. So after hours and days, if you're seeing it's continuing, especially if you're experiencing other symptoms. So drooping of the mouth, face, if you're confused, disoriented, speech is affected, now we're likely crossing over and we're looking at a stroke.
Okay, so we talked about stroke. What about a heart attack?
Heart attack, chest pain is the biggest one. Chest pain, shortness of breath, that we're going to see in men and women. But in women, they're more likely to have a silent heart attack. So a little bit less with the chest pain. It could be almost like a toothache, jaw pain, that strong jaw pain. It could be back pain, or it could be radiating down the arms, or even just one arm. With heart attack also too, we're going to see fatigue. Fatigue is going to be the biggest giveaway. Unusual, chronic fatigue. Doesn't matter how much you're sleeping. For a couple days, we're seeing fatigue. Right away, call 911.
Okay, so what is the importance of catching all of these early?
Yeah, great question. Importance is oxygen level. So if there's a burst or if there's a bleed or a blockage somewhere in our vascular system, it could be a blockage in your brain or a burst, could be in the heart that there's a blockage, or really anywhere. The heart isn't able to get enough blood, or there's now a perfusion and bleeding out somewhere in the body. That means that blood isn't getting to where it needs to go, either to the heart, to the muscles, to the brain. So not enough blood to the brain means that those cells are going to start to die off. And within minutes, depending on how much blood is able to get through, within minutes, that tissue is going to start to die off. And what that means for us on the outside is I walk over to, mom, dad, or even myself. I recognize some of the symptoms of either stroke, heart attack. If I don't call 911, if I delay, oxygen to the brain is going to go down. That tissue can't come back. So brain damage is what we're looking at.
Okay, so we're going to talk more about this. Don't go away. We'll be right back with more, and we'll find out when you should actually call 911. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's topic is cardiovascular emergencies in women. So, Kat, when do we call 911?
Immediately. There's really no other way around it. If you see signs of distress, immediately call 911. A big thing that we're seeing is people are driving themselves to the emergency room.
Oh.
So whether it's men, women, whoever, this isn't time to go to a walk-in clinic, drive yourself. Time to call 911 for any sort of cardiovascular distress that you're in. So that's sweaty, unusually sweaty, tired, chest pain. That's for a heart attack. We might see even that fatigue, jaw pain, radiating, immediate
But what happens when you're dealing with somebody and they go, you know what, I just need to catch my breath. I'm going to be okay. I don't want to go to the hospital. I don't want to be a burden. I think I ate too much, or maybe it's sunstroke, something.
Yes. I'm going to say it's your right as a first aider, and whether you have training or not, these are just basic tools. Call 911 for them. Call 911 for that person. That 100%.
Okay, well, because that's important.
Yeah.
Your life is very important.
Yeah, that's it.
So I want to talk more about heart attacks. We talked a little bit about it, but I wanted to discuss, what does this actually do to a woman's body?
So heart attacks especially can be affected by hormones, and we'll talk about menopause too. Our bodies produce estrogen, and estrogen, it keeps our blood vessels, it keeps them nice and elastic. So if you picture your artery kind of like a Play-Doh straw a little bit. Okay, so Play-Doh straw, every time your heart beats, it sends blood through that straw, and that straw is able to contract and move with that pressure of your blood. After menopause, or with hormonal fluctuations from even different medications that a woman could take, that estrogen can go down, and now it's almost like you left that Play-Doh out overnight.
A little bit harder.
It's harder, it's more rigid and more stiff, and now with blood pressure from your heart beating, now it's more likely to crack, or buildup is more likely to form inside of it too. So that's why even after menopause, women are more likely to experience a heart attack, or if there's hormonal fluctuations in a woman's body, a lot more likely to experience a cardiovascular emergency, heart attack or stroke, doesn't matter where. Yeah.
So, the next question that I actually had was, are heart attacks and strokes more likely after menopause? And you just talked about your blood.
Exactly.
Your veins, sorry.
Yeah, you're 100% right. More likely after menopause for women, because our hormones are fluctuating. And one thing that, there was one example I was reading about where a woman, she was approaching 50, but still getting her period, not menopausal yet. But her hormones had already started dropping. So she was healthy, she was a runner, but because of stress from her job, plaque was building up in her arteries and in her veins. So cardiovascular system was affected. And then those estrogen levels started to plummet. Before we realize, or our period stops happening, already your body, the hormones are changing. So for her, she experienced a heart attack, and it really was a wake-up call for her that here she was exercising, doing what she thought she needed to do, but there were still some lifestyle changes that needed to be made. And as her body was approaching menopause, there was so many hormonal fluctuations she didn't even realize that she was having.
You know what? That's really interesting that you just brought that up, because there are a lot of women who have had hysterectomies in their 40s, in their 30s, even in their 50s. But you don't think that that's going to affect your body in that way.
Yeah. And the interplay between all of our hormones and our vascular system is huge, and science is just now starting to fully understand, especially in women. And we were talking before the show too about pain management studies in women versus in men. Most of the pain management studies have been done on men, and now we're realizing, oh, women have a very different pain scale, a lot more tolerant to pain.
Yes.
So, and we often dismiss our symptoms, or we go to a doctor and might get dismissed a little bit if it's, oh, I'm just very tired. I've been having headaches. Oh, okay, just rest. But there could be so much more going on, whether it relates to our hormones or even our hormones now affecting our cardiovascular health too.
Okay, so I want to jump deeper into this. I want to talk a little bit more about this because, as you said, as women, our pain threshold is a lot higher than other people's. The other thing is we dismiss things. We're busy. You know, I've got this to do, I've got that to do. I have to get my to-do list done before I can take care of myself or do something. And that's something that we really need to look at. And we will talk more about that. So please don't go away. We'll be right back. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's topic is cardiovascular emergencies in women. So, Kat, let's get in because I know we have so much to discuss here. Okay, so as women, when should we get checked out?
The simple rule of thumb is you don't wait till there's a fire to check the smoke alarms. So regular checkups every year if you can. Blood pressure test.
I know.
Every year, and a physical every 1 to 3 years. Regular maintenance checkup is a lot better than, I'm feeling off. Let me go in and get checked out. It's a lot better to schedule those regular tests.
I think it's important too, as women, to know our bodies.
Yeah.
You know, I think we're constantly running around. We're constantly doing so many things. We need to understand our body. And if we are fatigued, because we are really fatigued, step back from things, take a break.
Yes. Knowing your baseline.
Yes.
I think you just need to know your baseline. And if you have a good routine, that helps you know what your baseline is. So whether it's exercise, even 2 to 3 times a week if you can, more if you're able to, but exercise, diet is a huge one.
Yes.
And we'll talk about prevention too, but diet and then time with family, quality time with friends, what that does to your mental health, what that does to your physical health, your stress levels. So know what your baseline is, and then you can know when you're teetering off of it for sure.
So, okay, so we go to see our doctor. We're having a checkup. We're saying, listen, this is what I'm going through. And they're like, don't worry about it. What do you do?
It's a good question. For me, I would bring my mom to every every doctor's appointment. Even my dad, he would go for his checkup, and my mom would send a little note like a little kid.
But you know what? That's important.
Yeah.
Because every time I go to the doctor or I'm talking, I have a note.
You have to.
I have a list of, 1 to 10. Yes.
Or how you've been feeling, or even tracking, your mood, tracking your energy levels for a week or so. Have that information written down and bring mom with you. For me, I would go in and they would ask, okay, how's your sleep? And I'm, oh yeah, it's fine. And my mom would be, no, it's not. Or how's your mood doing? And I'm good. My mom's like, no. So have them there with you, a close friend that you trust who knows you well too. And even having someone you can bounce back and forth with, that'll help jog your memory. Writing it down is amazing.
Well, the other thing too is, because sometimes when a doctor or a specialist, a surgeon or whatever is talking to us, we miss things. 100%. So it's really good to have an advocate for us. But the other thing too is you can get your cell phone and start recording the conversation.
Yeah.
So that, whatever you've missed, you go back home and then you listen to it.
Absolutely. Even also too, another good one is have your doctor, let's say you ask for a test and they refuse to give you a test. If you ask them to write down their refusal. So in my medical file, could you just write down that I've requested this test and you've refused it? Because sometimes that gives an extra incentive for them to just say, okay, you know what? No harm in
just do it. Yeah.
No harm in giving it to you. Better for them to have that than for it to be on their record that you've asked, you've requested, let's say, a heart test or...
That's interesting because I never thought about that before. Okay, so we were talking about nutrition. We were talking about, having a good lifestyle, working out. Everyone's looking at their weight, at their BMI, body mass index, what they eat. How do we avoid obsessing over health?
It's a great one. What I like to think of is don't obsess, invest. So instead of sitting there scrolling for hours and hours on Google, I think they call it cyberchondria, like hypochondriac, you're a cyberchondriac, and you're just on WebMD for hours. invest that time into something productive. So I'm going to put my phone down, news down. I'm going to hide alerts from, and I'm just going to focus on my family. I'm going to focus on giving to others, focus on my community, giving back, or going outside, going for a walk, exercising. So take the obsession and turn it into an investment instead. But if you're finding, and this is a big one, especially post-pandemic for a lot of people, is health anxiety, health scares. So there are great resources if you speak to your family doctor, even if you do a Google check, but for a psychiatrist, or those are great resources too. If you find that you aren't able to control that anxiety, get therapy for it. Yeah.
Okay, so we're going to come back and we're going to continue everything. So please don't go away. We will be right back with more talking about women's health and strokes and heart attacks, because these are really, really important things that need to be caught very quickly. We'll be right back. Welcome back to Empowered. I'm Elizabeth Naumovski. Today I'm joined by Katina Giggey. She's the CEO of LifeLime Teaching Limited, and today's topic is cardiovascular emergencies in women. Now, before we went to break, we were talking about Dr. Google, and which a lot of people are obsessed with. But the other thing I read, which I thought was really important, is people would go to AI and ask about things about
symptoms,
whatever it is, and 50% was correct and 50% of the answers were not correct. So we need to start honing in on our bodies, understanding who we are, what we are, understanding our own personal symptoms before we put it out into the cyber network
100%.
where, you know, we might not catch something. So speaking to your doctor on a regular basis is important.
Yeah.
Okay. So is there anything that we should do that is preventative to make sure that we don't have a heart attack or a stroke? Because that's one of my worries. I'm always worried about something like that.
Yeah. And what I would say is recovery and prevention, the steps are going to be the same, except it's just way more difficult after something has happened on your body. And we'll talk about that later too. But there's nothing to overthink when it comes to prevention. Exercise, sleep, diet, and time with your family, time with your friends.
A healthy lifestyle,
That's
basically.
really it,
right?
Yeah, there's no secret sauce. And especially, I find companies, they'll play on people's anxiety. So it's a lot of scare tactics used in marketing.
Yes.
Yeah.
And they should know better, because there are standards in marketing as well.
Yes.
But you're right. Like, I hear so many things on the radio, a lot of scare tactic commercials,
That's a huge
cancer or whatever it is.
Yeah.
And we need to step back from that, and we need to start dealing with facts.
Yeah.
And we need to understand, one of the themes that keeps on coming here is a healthy lifestyle, nutrition, working out,
invest in other people,
weights, stress management, proper sleep. So that just seems to be,
there's no
if not
secret.
exactly, if not on every program, every other program.
That's it. And companies will profit off of the anxiety of the crowd.
Yeah.
They just do. And it's not fair, but it just is what they do.
Well, we need to know better as well, right?
True.
And that's why you're here, and that's why we're having this discussion.
Yeah.
So what about coping?
Yeah.
We know what's happening beforehand. What about coping after suffering a cardiovascular emergency? What do we do then?
For coping, one friend of mine who's diagnosed with cancer, her and her husband, they decided to have one cancer-free day a week. So in this week, there's appointments, there's medications, there's so much. So she takes one of those days and they don't even mention her diagnosis. It's just quality time they spend together. They go outside, they enjoy, they just strengthen their bond with each other. And that lifestyle, that stress, it's still there, of course, because it's a huge diagnosis. Or if you go through a heart attack and now you're anxious, is this going to happen again? I'm worried. But having those days where you don't think about your illness, and try to turn that into most days if you can.
Right.
Because really, when it comes to prevention, lifestyle is what it is. that's going to be your main source of prevention.
Well, the other thing too is when we start obsessing,
Yeah.
and this is all we think about,
Mhm.
there's that dark noise in our brain. Nobody
Mhm.
else can hear it, but we can.
Yeah.
And that just keeps
it just over.
It's a downward spiral.
Yeah.
Right. So that's actually really helpful to people.
Yeah.
We only have 40 seconds left. We have to go. I take a CPR course with you. I take one every year. Why should anyone take a CPR course in 30 seconds or less?
It's one thing to hear us talk about it. It's another thing to do it. That's all I have to say. Yeah. It's one
And
thing.
what about this? Aspirin.
Aspirin, if you feel chest pain, crush 2 of those, take them, call 911. That could be a heart attack. Take them as instructed by 911.
Perfect. Thank you so much, Kat. This was wonderful.
Thank you.
Kat's closing words of wisdom to you are, you don't need to feel awful, just off. The steps to recovery are longer than the steps to prevention. I'm Elizabeth Naumovski, and I'm here to empower you and make frugality fashionable. I hope you found this really, really helpful, and I hope that you continue to watch Empowered. Thank you so much for watching. Bye for now.